Welcome to the Kern County Emergency Medical Care Advisory Board meeting of February 12th. At this time, we'll do roll call.
John Surface.
Here.
Tyler Weitzel.
Here.
Dr. Franklin.
Here.
Dr. Lyon.
Here.
Chairman Flores.
Here.
Orchel Crier.
Here.
We have a quorum.
Thank you. And at this time, it brings us to our flag salute. Mr. Surface, would you please lead us in the flag salute? Thank you.
Salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. That brings us to our consent agenda. All items with a CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda and it will be considered in listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. At this time, we have it in front of us. I'll call for a motion.
Motion.
Lyon, second.
Okay, motion and second. All in favor? Aye. Opposed? None. Okay, motion carries. This brings us to public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on the future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making any presentation. Any public comments at this time? Okay, seeing none, that brings us to board member announcements or reports. I'd like to congratulate Hall Ambulance on your 55th anniversary and for your dedicated service to the citizens of Kern County and being one of the #1 in the nation. So thank you.
Thank you.
Okay, that brings us to emergency medical services program requests. Mr. Ferris, item 3. Manager's report.
Thank you, Mr. Chairman. Well, call volume continues to create challenges to our system. In 2025, we saw an all-time high of over 140,816 calls. This represents a 1.1% increase from 2024. Ambulance response time compliance, however, continues to improve. For Priority 1 True Life Threat calls, Hall Ambulance Service had a response time percentage of 97.98%, and Liberty Ambulance Service had a response time percentage of 98.10% for 2025. Kern County fire agencies are maintaining an average of 10.01 minute response times to those calls. Ambulance availability and staffing levels continue to improve as well. Since August of last year, we have seen an increase of emergency response vehicles on the road by 25%. We recently discussed the training programs throughout the county and the continued push to produce EMTs and paramedics. These include Bakersfield College, Saracoso College, Taft College, and Hall Ambulance Service hosting 1 paramedic and 3 EMT academies per year. Hall Ambulance also reached a new milestone with 510 employees on their roster. Liberty Ambulance Service has reported that they are currently looking to fill several paramedic positions that have become vacant while maintaining full coverage in their EOAs. Additionally, Liberty is reporting an increase in the number of long-distance transfers that are taking ambulances out of their EOAs for extended periods of time, and yet they are still able to cover their areas. In the fourth quarter of 2025, the EMS certification team completed 134 EMT certifications, and Kern County accreditations. Newly accredited and maintained Kern County accreditations totals for paramedic, emergency medical dispatch, and mobile intensive care nurses totaled 32. Altogether, 166 renewed, newly certified and accredited applications. As we begin 2026, EMS has numerous projects in the works. The 2024-25 EMS plan has been approved by the state as of today. We have completed the emergency medical dispatch review for 2024 and 25 and are preparing to submit it to the providers for their review. Additionally, we are working on updating our website, the ambulance service performance standards, the ambulance response zone configuration, and non-emergent medical transport oversight, just to name a few. In 2025, our field crews made contact with telehealth physicians 5,224 times. This represents a 146% increase from the previous year. Of those contacts, 78.6% resulted in no ambulance transport. While these numbers and percentages are very promising, again, they are only representing about 3% of our total call volume. EMS is still actively searching for ways to reduce unnecessary transport of already impacted hospitals. The Cardia 12L program is up and running. The devices went live on February 1st, and in the first 10 days, we saw 192 12-lead ECGs submitted, with 5 of those indicating the possibility of a heart attack. These calls are being investigated by our QI team to determine patient outcomes. In each case, it appears that the EMTs treated the patient appropriately and transported to a cardiac receiving facility as per our protocol. As we all know, the first line and life-saving treatment for a suspected heart attack is the ingestion of aspirin. And in the first 10 days of the Cardia 12L program, we saw a 26.3% increase in aspirin administration from our EMTs. With the sun finally making its appearance, it reminds us that event season is upon us again. The EMS program has several events scheduled for this spring. Our involvement in these events includes medical plan approval, medical staff background checks, and for the larger events, we actually do site regulation and oversight. Upcoming events, we have Boots in the Park is expected to draw 8,000 people at the Kaiser Sports Village. That's on April 11th. Neotropolis, 3,500 attendees are expected. That's at the Wasteland World property in North Edwards. That's April 29th through May 2nd. Bequinox, 1,500 attendees are expected at the Seraphim Ranch in California City. That's May 6th through the 10th. And Luke Bryan's farm tour is back again. 20,000 attendees are expected at select farms near Shafter on May 14th. And then finally, our favorite lightning in a bottle is due back again. They are expecting 25 to 30,000 attendees this year at the Buena Vista Rec area, and that's May 20th through the 25th. Our emergency preparedness team, which includes our Region 5 regional disaster medical health care specialists, have been extremely busy working with the Region 5 counties and the state of California on the planning of the upcoming statewide movement plan, tabletop, and full-scale drills. Our EP team has already participated in various drills, exercises, and EOC credentialing training classes for the 25-26 year. Next week, our EP team is hosting the Healthcare Coalition meeting at the Kern County Emergency Operations Center, with over 60 coalition partners expected to attend. Additionally, our EP team continues to work with the County Emergency Operations Center as it transitions to a Type 3 credentialed center. And finally, EMS continues to provide community outreach through hands-only CPR, Stop the Bleed, Water Watchers, and Narcan administration. 2025 demonstrated the continued dedication, professionalism, and resilience of our emergency medical services teams. Despite increasing call volumes, operational challenges, and the evolving demands of pre-hospital care, our personnel have remained committed to delivering timely, high-quality emergency medical services to the communities that we serve. As we enter 2026, we continue to focus on strengthening response capabilities, improving clinical outcomes, enhancing training and professional development, and maintaining regulatory compliance. Investments in equipment, technology, and workforce development have further supported our mission to provide safe, efficient, and patient-centered care. As we move forward, our priorities will remain centered in operational excellence, staff wellness, community engagement, and continuous quality improvement. With the continued support of our leadership partners and dedicated field crews, we are well positioned to meet future challenges and uphold the highest standards of emergency medical care. That concludes my report, and I'm available to answer any questions.
Thank you, Mr. Ferris. Any questions or comments from our board or from the public? Okay, thank you for that extensive report and all the great work that's being done and what's on the horizon. I'll entertain a motion at this time.
Motion to receive and file.
Thank you. I'll second. All in favor? Aye. Opposed? Okay, motion carries. Brings us to item 4, APOT Task Force. The floor is yours again.
Thank you, Mr. Chairman. Unfortunately, Ms. Kerrigan is not able to be here today. She's in Maui, so we can all feel bad for her.
Place to be.
So I'm going to give the APOT report in her stead. So in 2025, the system saw the highest ambulance patient offload times to date at 43,312 hours of offload delays, which equals a 22.25% increase from 2024. An APOT task force meeting was convened in January to review system-wide progress and share best practices. A major focus of the discussion was on the staffing, infrastructure, and policy changes implemented at Antelope Valley Medical Center in Los Angeles County, which have resulted in substantial APOT cost savings and measurable operational improvements. The chief nursing officer from Antelope Valley Medical Center attended the meeting and provided a detailed overview of these initiatives, responding directly to questions from task force participants. Attendees expressed strong interest in the strategies presented and their potential applicability to other facilities. As a next step, the task force is exploring holding the next APOT meeting on site at Antelope Valley Medical Center, including a facility tour. This visit would allow participants, particularly from Kern County hospitals, to better understand the operational changes firsthand and assess opportunities for replication. A draft educational collaborative campaign titled "Help is Only 3 Digits Away" has been developed. The campaign is designed to improve community awareness around appropriate points of access for care by highlighting the correct use of 211 for community and social services, 988 for mental health crisis support, and 911 for emergency services. The campaign aims to support more appropriate utilization of emergency and crisis resources, which is expected to positively impact APOT and overall system efficiency. A system-wide launch is targeted for March or April of 2026. Looking ahead, continued collaboration through the APOT Task Force, replication of the proven operational models, and targeted community education efforts remain key strategies for sustaining and further improving APOT performance across the system. That concludes my report, and I'm here to answer any questions.
Thank you, Mr. Ferris. Any questions or comments from the public or from our board? Seeing none. Thank you for the report and for the potential of the AV strategies. Hopefully, we can incorporate them here, and we have a willing audience and willing participation to really listen and see what can be done. And it's also a sobering reminder of the stats that we had last year, so we could really benefit from that.
Mr. Chairman?
Thank you. Yeah.
You know, Jeff and I talked earlier about APOT. The fact that Antelope Valley Hospital has turned things around is remarkable. They held the record for 30, we had an ambulance there for 36 hours. We've had multiple 24-hour offloads at that hospital. We've done shift change at the hospital time after time after time after time. And now they're one of our fastest hospitals getting us offloaded. So whatever they got figured out, we all might want to pay attention to it.
Thank you. Thank you for that. Concur. Okay, at this time, I'll entertain a motion to receive and file the APOD task force report.
Motion. Second.
Okay, thank you. A motion and second. All in favor? Aye. Aye. Opposed? None. Okay, motion carries. That brings us to item 9, the Maddie Fund request. Mr. Ferris, the floor is yours.
Thank you, Mr. Chairman. On February 14th, 2019, the Assistant Director of Public Health reported to the Emergency Medical Care Advisory Board that EMS was releasing the discretionary portion of the Maddie Fund for enhancements in the EMS system as approved by your board. Merriam-Webster Dictionary defines enhancement as heighten, increase, especially to increase or improve in value, quality, desirability, or attractiveness. The intent of releasing the discretionary Maddie funds by the county is to heighten, increase, and improve from the norm and customary base operations the delivery of pre-hospital care to the people of Kern County. This would include programs, services, trainings, equipment, and/or learning materials that would have a high likelihood to improve the Kern County EMS system of care from its normal and customary base operations. The requested item, service, or training must benefit all EMS stakeholders, especially the community at large, in such a way that it improves the quality and delivery of pre-hospital care. With that said, on January 20th, 2026, I received a properly formatted request via the Kern County Maddie Fund request form available on the Public Health EMS website. The Kern County Sheriff's Office is requesting the release of $19,893.22 for the purchase of the following training aids: 16 adult CPR mannequins, 16 infant CPR mannequins, 10 Zoll AED Plus trainers, 3 cases of adult BVMs, 3 cases of infant BVMs, 4 wound packing trainers for gunshot or stab wounds, 50 combat application tourniquets, 50 Israeli bandages, 375 quick clot combat hemostatic gauze moulage trainers, and 2 cases of Primed compressed gauze. At this time, I believe that the author of this request is in the audience, Mr. Chairman, and is here and would like to present his case to the board for the release of these funds.
Sure. Thank you. Yeah, please come forward.
Good afternoon, members of the board.
You're welcome.
My name is Deputy Colin Desmond, COLINDESMOND. And I am the current clinical director of our medical programs at the Sheriff's Office, and I'm here to present some context and justification for a request from the Maddie Fund. Due to the nature of law enforcement operations, deputies are actively patrolling communities and often able to respond to 911 calls much quicker than our counterparts in the fire department or emergency medical services. Deputies are routinely the first emergency personnel on scene of critical incidents such as shootings, stabbings, traffic collisions, opioid overdoses, cardiac arrests, respiratory arrests, and chokings. Deputies can often perform life-saving interventions before fire department and EMS personnel are able to reach a patient. The Commission on Peace Officer Standards and Training requires peace officers in the state of California to receive 21 hours of first aid, CPR, and AED training. The Kern County Sheriff's Office exceeds this standard and provides 32 hours of training during our basic academy. Additionally, which is unique to law enforcement, each marked Sheriff's Office vehicle carries an AED at all times. Since the program's inception, the Sheriff's Office deputies have deployed an AED on 178 patients in the field. In 2019, the Sheriff's Office became the 4th law enforcement agency in California to carry Narcan. Since then, we have deployed Narcan in 34 patients. During incidents where persons have been victims of gunshot wounds, stabbings, vehicle versus pedestrians, and train versus pedestrians, our deputies have applied tourniquets, bandaging direct pressure wounds, and stopped serious bleeds. If approved, the purchase of CPR mannequins, training AEDs, bag valve masks, advanced wound packing trainers, tourniquets, pressure bandages, and hemostatic dressings will replace our aging and outdated equipment. With this equipment, Sheriff's Office training personnel will be able to provide more realistic training to deputies, and will be able to better integrate with our partners in the fire department and emergency medical services. So, thank you.
Thank you. Thank you so much for the context and what's going on the front lines and the need that presents, and appreciate your comments.
Yeah, thank you, sir.
Any comments or questions from our board? Okay, this time I'll entertain a motion on the Maddie request.
Lyon, motion to approve.
Okay, okay, motion and second. All in favor? Aye. Okay, opposed? None. Okay, motion carries. Congratulations.
Oh, thank you, gentlemen.
Thank you.
Thank you
for
for your
keeping
time.
us safe.
Thank you. Thank you guys for keeping us safe. So.
Okay, that brings us to item 11, adjournment. The deadline for submitting public requests for the next MCAB meeting is Thursday, April 30th, 2026 at 5 p.m. to the EMS program manager. And at this time, I'll entertain a motion to adjourn to Thursday, May 14th, 2026, here in the same chambers at 4 p.m.
So moved.
Okay, we're adjourned. Thank you.